Hi, everybody. This is Steve Tarter, another edition of Tarter Sauce here at the Peoria Journal-Star in Peoria, Illinois. And with me today, Doug Johnson. Doug, welcome. You are the co-chair of the Peoria chapter of the Democratic Socialists of America.
That is correct.
And you don't mind the word socialism being expressed.
Not at all.
No, Doug, you are also working IT here in Peoria, and the issue that kind of brings you here today, Medicare for All. We hear that phrase is being bandied about. What's your take on that? What's Medicare for All?
Well, Medicare for All, from my perspective, and well, from DSA's perspective, and you see a lot of the kind of the bickering within the Democratic Party over what it means right now. But for us, what it means is a truly single-payer healthcare system, one that eliminates the private insurance market, one that decommodifies health insurance as just a product to make a profit from. And Medicare for All to us primarily means guaranteeing healthcare as a right to all people in this country. And
of course, we heard about this in the Bernie Sanders candidacy from 2016, which generated a lot of interest. Had you probably yourself, were you a Bernie guy? Did you feel the burn?
I felt the burn. There's still a bumper sticker on the back of my old car. So,
well, that's great. I mean, and I say that's great, but it seems like this is a, we've already seen the present administration trying to dismantle as much Obamacare as they can. One would think, boy, this is a huge hill to climb for the American public.
Yes, absolutely. I mean, the biggest struggle from our perspective is really coming up against kind of the corporate business community when it comes to legislation like this. When you actually look at the polls for legislation, even if you kind of simplify the wording down to universal health care or things like that, you see massive support among the people for a system like this. But I think ultimately the challenge, when you see all these numbers coming out about how much it's going to cost,
right,
a lot of this is coming from the health insurance industry. It's coming from the pharmaceutical industry. It's coming from people who seek to make profits off of the health
These are not
industry.
Small industries.
Correct.
I mean, insurance, medical, pharmaceutical. I mean, these are giants.
Absolutely.
And so it's really, is it a David and Goliath thing at this point?
Well, it really depends on how things shake out. It's hard to predict the future, but I think we are seeing a shifting tide today on this issue, and this issue has existed for over 100 years in this country. I mean, even FDR back in the 1930s was talking about a national health insurance program. Harry Truman, championed that, and they used to call it socialism back then too. But
when it wasn't a dirty word.
Correct. Yeah. But I mean, this kind of is a David and Goliath scenario when you look at kind of the history of what working people are used to getting. Any time that we need, a bailout, we might not get it quite as much as the business community might, as we saw in like 2008. But I really think the tides are shifting. We're starting to see a big popular movement towards kind of working class wins. We're seeing political tides shifting all over the country, and now for the first time ever, we're going to actually start to see hearings done in the House of Representatives on Medicare for All
the concept
legislation. Yes.
When you mentioned how it's been addressed in the past, I was thinking, I don't have good memory of it, but David McCullough's book about Truman, there's a part in there where he talks about Truman had it down as something he wanted to get through in his agenda, and I can't remember now what derailed that, or it was put off, and obviously things happen like that all the time. How do you address the fact that somebody listening or watching this right now might say, well, I know it's expensive, and we have nothing but trouble with looking at medical bills, but I don't know if I'm ready for Medicare for All. I mean, are we gonna totally abandon what we've already got? I mean, what about my taxes? I mean, people are gonna have a lot of concerns here.
Absolutely. And ultimately, this is what it's going to come down to, selling to people to support this. I think ultimately the right answer to that is it's actually cheaper than what we're paying for right now. When it comes to how much we would pay, specifically depending on who you are, depending on where you fall on the income scale, if you look at the multiple different studies, even the right-wing kind of libertarian-backed studies done on this show that we would save over $2 trillion over the next 10 years. The most comprehensive study on Medicare for All that we have in existence was done just in December 2018 by the PERI, which is the Political Economy Research Institute out of University of Massachusetts Amherst. They have done the most comprehensive study on this in existence, and what they show in their study is that it would save over $5 trillion over the next 10 years. And this means total health expenditures. So there's multiple different ways that you can go about actually paying for it, as shown in some of these studies. But as far as how to pay for it, the answer I would like to give to that is it's a lot easier to pay for something that's cheaper than what we're paying for now. But as far as the employer health insurance concern goes, I mean, this comes up anytime any major system is to be shaken up. People don't want to lose the things that they have fought their lives to they either don't have, or they have fought their lives to barely be able to cobble together, and nobody wants to lose that. Right. But that is absolutely a legitimate fear to have. But ultimately, pulling the profit motive out of health insurance, we believe is the best possible thing we can do for our system.
And it's such a challenge. I mean, for all the reasons we've already said, the opposition is well funded, well heeled, skilled in convincing people, influencing the public, scaring the public.
Absolutely.
These are all things you're up against. Is there now? Oftentimes, I've heard this in the past. Well, we don't want a system like they have in Canada, or we don't want something in England. And is there a system somewhere? Because I know in Europe they've embraced the idea.
Sure.
So what model should we look at?
So I think there are things that we can pull from different models, and I think that's kind of what the current legislation that's about to be released, the Medicare For All Act of 2019, Pramila Jayapala, House Representative from Washington, is actually going to be releasing that legislation coming up soon. But from the different models to go off of, I mean, you can really get down into the weeds when it comes to specifics. But when we look at these systems in general, Canada spends half as much as we do per capita. So that's not just total expenditure, that's per capita. And they have better health outcomes. When you look at Norway, which Norway is a completely socialized healthcare. Now we're just talking a national health insurance program, but like in the UK and in Norway, they actually have government-run healthcare, not just the health insurance program. But I think there's multiple aspects of the different models that are clearly shown to work. I think the biggest thing to think about in regards to that is every other country in the industrialized world guarantees healthcare as a right in some way or another, and we don't. We are the only country in the industrialized world that does not do that.
And why do you think that is?
Well, that's a good question. You can this conversation can go on forever, but I think it comes down to a political system that is completely dominated by money. It's completely dominated by special interests and corporate interests. We have a political system that is owned and run by a small group of economic elites, and more, I think what we are starting to see politically, when we're seeing the reaction to all of this, is in response to that.
Right. Now, what about, let's take it back to bring it home here to Peoria. Peoria is now looked at as a medical center. We've got two big complexes, hospitals, but that have many other hospitals connected with them. We have a medical school here. Would that change under, I mean, obviously we're throwing this out as a hypothetical, because we don't even know yet what stages or the degree of change and all that. But if we got approval for Medicare for All, would that change what we are here?
I don't think it would. So whenever you kind of hear the fear mongers throw out this socialized medicine word in response to single payer healthcare, we're not talking about the government taking over the hospitals and taking over the doctor's offices and taking over the private practices. We are talking about a government health insurance program. So all it would change is the health insurance. It would not change anything about the practices that currently exist.
In fact, the very insurance that one has to show or use, it would just come from a different source.
Absolutely. Right. Okay. Absolutely. That would be the only difference. And then in this scenario, there would be no financial barrier to getting your health care.
Is one of the arguments that involved here is about doctors' pay? Physicians, do they make less in Norway and Canada than they would? I know I've heard that in Germany. What about here?
Well, that's a good question. I have heard that as well, and it's hard to take into account every single factor that would account for that. I mean, there's completely different costs of living in different countries and things like that. However, the study that was done by PERI in December talked about this a bit and how things would change as far as doctors' payments would go. There's been a little bit of concern over, Medicare payments being less than what a private private insurance company would pay to a provider. And the current legislation, I believe, is kind of based on Medicare rates. But at the same time, Medicaid rates are lower than what Medicare pays. So some of that would balance out in that scenario. But also the massive, massive administrative overhead that would be eliminated by removing the private health insurance industry. And I mean, some of these numbers are showing that some hospital staffs, like 50% of the staff is just filling out insurance paperwork. I mean, think about all of that just completely or mostly being eliminated. Without having to do all of that administrative work, doctors and healthcare teams would have so much more time to see more patients, spend more time with their patients, rather than dealing with things like insurance paperwork. But if you actually look at the studies, they do account for that.
I'm thinking of how this might play out, and we just had the most recent in Peoria. Every 4 years we go through this thing, or 5 years, with the water company. Should we buy the water company? And both sides mount arguments, and I won't get in. We won't review that here. But I know one of the arguments against the city taking over what would seem to be a natural thing, controlling its own water, is, have you seen the way the city handles things? My gosh, you want to have them handling your water? And I'm just thinking ahead that somebody's going to put that same argument to, well, the federal government, they're just going to mess up medicine, but yet they run Medicaid, and no one's complaining about that. Right. For those 65 and over.
Sure. Right. So that is going to be something that we are going to deal with until the end of time. The same people who would say government can't do anything right are also asking you for your vote to be elected to government. So these are people who, it kind of seems like a self-fulfilling prophecy sometimes. If you kind of go back in history and you see the kind of, the Reagan Revolution, well, they kind of went on and on about how government can't do anything right. We need less and less government. So they get elected to government, they cut government, and then they turn around and point to that and say, see, it doesn't work. They just, So I don't know. I kind of don't buy into that. I have a little more, and especially being a socialist, for me, ultimately it comes down to democracy. If we are going to have the ability and the level of democracy to be able to accomplish something like Medicare for All, then I have more faith that, that we will stay in that fight. We will continue to, as citizens, be engaged with our government and electing people who should be there making the right kinds of decisions.
Now, you're part of we're talking with Doug Johnson, part of the co-chair of the Democratic Socialists of America in Peoria. These certain words get demonized. Communism. If you're a communist, boy, you got some explaining to do.
Sure.
At least in this country. Socialism, you can imagine candidates throwing that at somebody. So, do you want socialism, as if that in itself is an indictment? How do you look at that? Why is socialism a dirty word? And in your mind, it obviously isn't.
Right. Correct. So it's kind of nice being able to live in a time now, and I'm not going to pretend I've always been this self-realized socialist for a long time, and all of a sudden it's so nice to be in an environment where it's open. I kind of became a socialist as as the S word has gained more popularity and less taboo around it. But socialism for us means something completely different from what the traditional kind of, I think, more pro-capitalist forces would just throw the word socialism out there just to kind of shut down the conversation, and clearly that's not something that's going to be talked about anymore. But socialism for us ultimately comes down to democracy. When you look at these past like socialist or communist states, which you can't really conflate the two, but as democratic socialists, we are just as much against one-party ruling states, authoritarian governments that existed in the USSR, that have existed all over the world, that are typically used as examples of socialism. In our minds, that wasn't democracy being displayed in those countries. That wasn't workers owning and controlling the means of production. That was just authoritarian control of a government. So we don't believe that government simply performing services is socialism. I mean, if you're going to boil it down to that, then every government in existence is a socialist government, because you have to fund
collect
things
taxes,
somehow. Yeah. So it's not that simple for us for socialism. And a lot of times people try to just conflate big government with socialism, and we'll be the first to say we don't want some bloated, massive, big government either.
Doug, you might know this, but you know, and again, my history is shaky at best. But in the 30s, I believe, in California, socialist candidate ran pretty strong for governor. And I can't remember the name now, but again, that's a part of our history. So, I mean, and he put it out there as, this is what I'm going to do, and people looked at that and said, "Oh, yes, that's what we want."
Was that Norman Thomas?
It might have been Norman. Yeah, Norman Thomas. Thank you. Yeah. So I mean, so it came from a great sort of a springboard of ideas.
Absolutely. I mean, we actually have a long socialist history in this country. Even after the Civil War, when you look at the Reconstruction period in the South, I mean, there was a lot of socialist principles coming up through there. In the early 1900s, Eugene Debs, who founded the Socialist Party, he ran for president from jail, was put in jail for...
That's got to be a tough one.
Oh, yeah, for criticizing our involvement in World War I, and he ran and got 1 million votes while he was running for president in jail. But then we also have huge leaders in our past that have been democratic socialists, like Martin Luther King Jr., we have Dolores Huerta. We have today people like Cornel West. But I mean, in the past, socialists have been at the core of every struggle for justice that have existed in this country.
We're talking about Medicare for All, and of course, this is going to be heard. We're going to hear a lot about it. Because we're entering a campaign period, and and you've got a number of Democratic candidates on one side that are embracing what Bernie Sanders kind of, I guess you could say, sort of made public in 4 years ago or several years ago. Some, you know, you mentioned it would be cheaper. We're going to hear probably figures on both sides saying, "Oh no, it's going to cripple us. We're going to go bankrupt." What can somebody do who's watching this or listening to this to find out more? Maybe to say, I don't want to get just the soundbite version. How do I get more info?
Sure. So the first couple of things I would say that you need to know about Medicare for All is it can be a little confusing because you're going to see different explanations of it from different sources. The Bernie Sanders interpretation of Medicare for All means a truly single-payer health care system. Some of the candidates who are championing Medicare for All today, some of them are talking about on the campaign trail maintaining the private health insurance industry somehow in there. Some are talking about watering it down. Others are kind of talking about doing a plan where people who are 55 can buy in, and then kind of lowering it as time goes. But if you want to look up good information about Medicare for All, there's a number of good resources out there. One, I would look into Bernie Sanders' proposal that he put in the Senate. In the past, there's always been a proposal on the House called H.R. 676. That's been like the kind of long-standing messaging bill on Medicare for All. But what's about to be released is a new version of that, and it's going to be a completely comprehensive legislation to actually hold hearings on. But if you want to look at information about kind of the impacts, kind of studies done, and if we'll be able to pay for it, things like that, one of the studies I had mentioned earlier, once again, is done by the PEIR, or PERI, the Political Economy Research Institute at the University of Massachusetts Amherst. They do a complete study on specifically Bernie Sanders' proposal that he put in the Senate. And they even kind of alter some of the portions of it to see what would happen in this scenario or this scenario when it comes to how we pay for it. And there's really good information out there for all of that.
In your heart, what do you think? I mean, are we going to get... I guess it all depends on the voters and what candidates come forward. So we're a little early on that. But do you see this thing taking sort of over a period of time, or do you think it could be abrupt? Yeah. What's your reading?
Well, for me, I think if this is going to pass in the way that we want it to pass, I think, and this is just my personal opinion, the way we've gotten those kinds of things in the past, it's kind of been these short bursts of progress, these like short, big bursts of progress. And I hope that that's what we get with Medicare for All. Because my fear is if we take this incremental, gradualistic type approach, those are the kinds of approaches that we're kind of already starting in the middle with negotiations, and you end up kind of with something completely watered down. If you remember when it came to the ACA, they were kind of talking about single payer in the very beginning of those talks, and then it kind of...
We're talking about Obamacare.
Oh yeah, Obamacare, yeah. And then it kind of went to a public option, and then eventually it just all disappeared. We kind of started our negotiations in the middle. They immediately started comparing health insurance plans to a TV, like a product, to have a market to be profit off of. So we didn't get any of that because we started at a compromised position. So I think we're only going to get this if we actually see a mass movement of working people across this country coming together to do things like the Barnstorm event that we had on Saturday, where people actually sign up to host events, to canvass and talk to their neighbors, talk to community members, and talk to anyone and everyone about this actual legislation. It's the only way we're going to be able to accomplish it.
And, you know, one of the things that, you know, you're up against, I say not necessarily you, but the effort to change our health plan is, I just saw this statistic, 60% of the country receives coverage through an employer.
Correct.
And I don't know how accurate that is. That's what I saw online. But, you know, that sounds like, you know, okay, that would make some sense. So you're going to, that will be the group that I think you're going to need to get to. Not that everyone is going to agree with anything, but, you know, if you get some buy-in for those folks that are already covered.
Yes. Because
I'm assuming people that aren't covered are going to love this.
Oh, sure.
Because this is an opportunity to get health care that they haven't at present got.
Right.
But the political football is going to be flying freely on this one.
Correct.
You know, and I think people need to maybe understand that you're going to hear a lot of things that maybe aren't true. Sure. Which is probably true of any campaign.
Sure. Well, and as I said earlier, the first people that you're going to hear stand up and scream about it are going to be the employer class themselves. And I don't mean like the typical small business owner. Can you imagine if small businesses didn't have to cover health care expenses? I mean, that in my mind, that would be a great boon for a small business. But the first people you're going to hear come out and fight against it are going to be people like the Howard Schultzes out there saying it's absolutely ridiculous. The Michael Bloomberg saying it's impractical. All these CEOs who have tremendous control over their employers' well-being by being able to control their health care plan. I think the employer class is going to be the biggest struggle to fight against, because I think that if you sit down and actually have a conversation with regular people, even people who are happy with their health insurance plan, and you show them that they would no longer have to pay any premiums, no deductibles, no copays, nothing at the point of use, and they get to save thousands of dollars a year on their health care expenses, I think it's an easy sell for regular people when you show them that. But once again, this all gets filtered through a media that is owned by the same kinds of people who think it's impractical, and they're people who make billions of dollars a year. But But I mean, some of these.
They can run commercials morning, noon, and night.
Oh yeah, absolutely. Well, and then they can also go ahead and donate a couple $100,000 to the congressional rep in the district, and also to who's running for president, and also who's running for Senate. And so these people have a tremendous amount of control. And you know, for me personally, and for socialists, a big part of this fight too would be realized in ways that you don't necessarily always think. So how many people out there are working jobs that they are absolutely miserable at, but they have to because of the health insurance that job offers? Or
it covers a spouse or a child.
Yes, absolutely. And the amount of freedom that it would bring to no longer have that to be the primary reason why you're working at a job, I think would be felt all over the country. Also, when it comes to running a small business and you have to compete with these giant companies who have more than enough money to provide health insurance for all their employees, and you know, and as you as a small business owner are getting shut out, like say by the Walmarts of the world, the advantage that you would get to be able to use that extra money to hire, to invest back into your company, those kinds of gains I think are major. And then the one that I think, the type of gain that I think would be the most impactful is when we talk about our political divide today, we see all of these divides all over the place. And the divide that I would like to see removed, that I think really holds us back from a lot of good conversation, is when you have someone who makes just enough money to not qualify for something like Medicaid, and then they look at people who don't make enough money, who are on Medicaid, and they have this, you know, real feeling of like, you know, why don't I qualify for that too? And then you have these demagogue politicians that come around trying to divide us all from each other, and they'll turn and say, well, look at that poor person. They don't work as hard as you do, and they get all these things that you don't get. And it would just eliminate that whole competition over something that should be a basic human right. Or healthcare, right?
How do the I think I've heard this, but maybe you have it better than I do. The employers get. But how did we get started with employer health? Was it as an incentive to get people working again, or because I know that hasn't been the standard for all time, that you would get your health insurance through your employer?
Sure. Well, I think we saw the major rise of that in like the early 80s or the late 70s or something like that. I don't have the full history of you know, how we got here today down, but what I do know is that I think it mostly has gotten this way because of the, you know, there being a profit motive on health insurance, and kind of health insurance being a tool of control that the large employer class likes to use.
Right.
For sure.
Well, Doug, we've been talking about Medicare for All here, and want to have you come back and see how this goes. Maybe once the candidates kind of sort themselves out, or we hear this, maybe a plan will evolve.
Sure.
That will come forward. Well, I want to thank Matt Dayhoff and Adam Garrick for getting all this new technology here on parade at the Journal-Star. But we thank them for getting us on the air, and we'll see you next time on Tarter Sauce.